So for me, this is terrific because this is the first time we've actually held a SWAN event in Windsor. And so it's so nice to have Hotel Dieu Grace Healthcare host it and have you here. So before I get started, how many of you would have heard of SWAN before you signed up for this event? About a third of the room. Okay, so that's helpful for me. So I'm going to walk you through a little bit about how SWAN came to be and what it's been doing and how you might get excited enough that you'll participate in other ways. So in 2011, there were approximately 5 individuals located in London. One was the president of the university who just started, Dr. Chakma. Another was the CEO of London Health Sciences Centre, Bonnie Adamson, the CEO of St. Joseph's Healthcare, the president of Fanshawe College, the dean of health sciences, and the dean of Schulich School of Medicine and Dentistry. And they thought that it would be really helpful to start an academic health sciences network. And so what they did was they decided to host a retreat in the fall of 2011 and bring together about 150 people who knew nothing about an academic health science network to try to problem solve, if we did develop them, what would it look like? Now in that period of time between the time they first met and the retreat, I was actually hired as a vice dean at the School of Medicine and Dentistry at Schulich. And so one of my deliverables was to actually develop an academic health science network, and I thought it would be really important to do it regionally so that it would really be across from Windsor right up to London and then up to Grey Bruce, etc. So as a result, I started working with my colleague Robin Walker, who's the Integrated Vice President of Medical Affairs and Medical Education at the 2 London hospitals, to develop and craft a vision. And we went around Southwestern Ontario, met with educators, researchers, hospital teams, colleges and universities. And as such, we came up with a strategic plan, which we actually launched in Chatham in 2013. So this network has been evolving, and we finally have a manager, Catherine Joyce, who you probably met at the registration desk. And since we joke that SWAN has really increased substantially since we have Catherine. So we talk about the BC before Catherine and the AC after Catherine. But the vision of SWAN is really transforming health in Southwestern Ontario through integrated excellence in research, education, and clinical practice. So when we've gone to talk to people, they say, well, how does this differ from the LINS? And the main significant difference is that it's the integration of academia into health and looking at health from prevention, health promotion, right up to treatment interventions. So SWAN encompasses, as I mentioned, Southwestern Ontario, so LINS 1 and 2, and our population is about 1.6 million people. We have a myriad of healthcare facilities as well as networks. We actually did a survey of 103 community health networks and 9 academic health networks, which we published in the Journal of Community Health. It's actually on our website. And we asked those individuals what they would see the network doing to help support integrating academia. So they gave great suggestions. We have the 3 community colleges, St. Clair, Fanshawe, and Lambton College. We have 3 universities, University of Windsor, Western, and the University of Waterloo. So you might be asking yourself, the University of Waterloo is actually in LIN 3, not in LIN 1 and 2. But the University of Waterloo has a school of pharmacy and a school of optometry. So those are health sciences programs which we don't have in LIN 1 or 2. So they've been really active participants in SWAN. And we also have a number of educators and researchers. So in 2010, there was actually a paper written in Canada called 3 Missions, 1 Future, and it looked at networks and how do you establish networks and what were the goals of networks. And in Canada, there's 1 in British Columbia, 1 in Saskatchewan, 1 in Toronto, 1 in Quebec, and 1 in the East. But ours is actually quite unique for a variety of reasons. One is it's very community driven. We have a lot of people from the community involved in developing SWAN and participating at various levels. It's also regional. The other networks are either provincial or, in the case of Toronto, a city, and some are, so ours is the only one that's regional. The population demographics in Southwestern Ontario are probably aware that we have higher than the general population of problems with chronic lung disease, cardiac disease, diabetes and obesity, as well as mental health, and we have a larger than the general population of older individuals. We have a culturally diverse community, and Windsor knows that probably far better than anyone else in our region because you're the fourth most multicultural city in Canada. And we also have pockets of, Mennonite individuals. We have in Leamington, we have a strong presence of people from Mexico, and we also have First Nations, Indigenous populations here. We have a variety of healthcare settings, lots of educators and researchers. We have the networks that are already existing, and we have that continuum of rural, small city, and mid-sized city. So, if you present to researchers, they're very precise. So I used to say large cities, and they told me, no, from a research point of view, we're actually mid-sized. So Windsor and London are not large cities. And of course, to you, you're very close to the US, so there are differences and opportunities there as well. So some of the overarching goals of SWAN are to lead in academic integration across the region, educate health professionals and researchers really in advancing interprofessional education, enhancing knowledge translation, engaging in collaborative research, and really leading in policy development. So those are pretty big, lofty goals, but we hope over time we'll be able to achieve them. So we have a governance structure, so we have a steering committee. So you met Ken Blanchette, who's our co-chair from the Erie St. Clair LHIN, and the other co-chair is Gillian Kernahan, who's the CEO of St. Joseph's Healthcare in London. And then we have representation from the LHINs. So currently the two LHIN CEOs alternate on the committee. We have somebody from the 3 community colleges, the 3 universities, and representation from 2 hospitals in LHIN 1 and 2 hospitals in LHIN 2, as well as LHSC and St. Joseph's. So they've been meeting since the inception of SWAN, and so we're hoping that the terms will evolve over time. So a little bit more about our governance structure. So as I mentioned, I co-chair the operations committee with Robin Walker, and we have 4 main committees. One is the community engagement committee, and that's where mental health and addictions working group, who've put on this symposium, sit. And we also have a nutrition working group. And as I mentioned, we published a survey of networks in Southwestern Ontario, and we also did a community health profile. So if any of you are looking for stats around the health of Erie St. Clair and want to use it, it's actually posted on our website, and there's an executive summary of how you can use that document. We also have an education committee, and within that we have 3 working groups. One's simulation, the second is interprofessional education, and the third is palliative care. The third committee is the Knowledge Generation and Translation Committee, and we have 2 working groups. One's Research Ethics Harmonization, and one's Choosing Wisely. So we're always looking for people who are interested in participating at the committee or the working group level. What we've tried to do is have co-chairs of each of the groups, one from LHIN 1 and the other from LHIN 2, and ideally from 2 different professions. So one might be social work, the other one might be nursing, for example. We also have a communication advisory committee, and they actually helped us do the word mark of SWAN. So we had tried to engage some students in this, but they really wanted swans, like nice swirls and stuff, but we felt it was probably better to have a word mark. And we also have a website, so please go towards that. We're also putting events on there, so even if they're not sponsored from SWAN and you're looking for an event in the area of mental health or obesity or whatever, you can actually go on that site and find things. So this conference, Symposium, Evaluation, Resilience, and Sustainability in Family Mental Health and Addiction Peer Support, actually came about because we had a meeting in the fall of 2015 around peer support for mental health and addictions. And during that conference, we learned things that were happening locally, and I mean LINS 1 and 2. We heard about what was happening provincially as well as nationally. And through the discussion of that day, we identified that family mental health and addiction peer support was seen as an area of need. And one of the things about SWAN is we see that we're a network of networks, so we don't want to duplicate things. We want to fill in gaps and try to connect people and foster new initiatives that would integrate education and research. So the importance of this symposium is really to raise awareness of this particular issue and determine if we can advance education and research in this area across SWAN. So the objectives today are to increase knowledge about family, caregiver, mental health, addiction, peer support initiatives in Southwestern Ontario, to facilitate research networking and collaborations between community and academia. So if there's something, you're a community participant, and there's something that you find interesting that you'd really like to know more about with respect to family peer support, then hopefully you'll connect with some of the researchers, or we could help you find researchers who could answer that question and work with you in a community participatory way to advance the area. We want to increase research effectiveness and outcomes through partnerships between community and academia, and to encourage knowledge transfer through collaboration between researchers and knowledge users. So again, just so that you're going to be dreaming about this tonight, the vision of SWAN is transforming health in Southwestern Ontario through integrated excellence in research, education, and clinical practice.